COVID-19 is a disease. It is caused by a virus. The virus is called SARS-CoV-2. This virus is very contagious. It spreads easily from person to person. COVID-19 emerged in late 2019. It quickly became a global pandemic. The virus is always changing. New variants emerge over time. These variants may spread more easily. They may also cause different symptoms. Scientists are constantly studying the virus. They track how it evolves and spreads. COVID-19 affects people differently. Some people have mild symptoms, others become very sick. Some people need to be hospitalized. Sadly, some people die from COVID-19. Vaccines are very effective against COVID-19. They help protect people from serious illness and death. It is important to stay informed about COVID-19. Follow the advice of health experts to protect yourself and others. COVID-19 spreads primarily through respiratory droplets. These droplets are released when an infected person talks, coughs, or sneezes. You can become infected if these droplets land in your mouth, nose, or eyes. The virus can also spread through the air. This is called airborne transmission. Tiny particles containing the virus can linger in the air for a while. You can become infected by breathing in these particles. It's possible to get COVID-19 by touching a contaminated surface. This could be a doorknob, tabletop, or phone. If you touch your face after touching a contaminated surface, you could infect yourself. To prevent the spread of COVID-19, wash your hands frequently with soap and water for at least 20 seconds. Use hand sanitizer with at least 60% alcohol if soap and water are unavailable. Cover your mouth and nose with a tissue or your elbow when you cough or sneeze. Avoid close contact with people who are sick. Stay home when you are feeling unwell. COVID-19 affects everyone differently. Some people have no symptoms at all. Others experience a range of symptoms that can be mild to severe. Common symptoms of COVID-19 include fever or chills, cough, shortness of breath or difficulty breathing, fatigue, muscle or body aches, headache, new loss of taste or smell, sore throat, congestion or runny nose, nausea or vomiting, diarrhea. These symptoms can also be caused by other illnesses, like the flu or a common cold. It's important to get tested for COVID-19 if you experience any of these symptoms. Most people who get COVID-19 experience mild illness. They recover at home without needing medical care. However, some people develop severe illness that requires hospitalization. Risk factors for severe COVID-19 include older age, certain underlying medical conditions such as heart disease, lung disease, diabetes, and obesity, weakened immune system. Severe COVID-19 can lead to pneumonia, acute respiratory distress syndrome, sepsis, blood clots, heart problems, multi-organ failure, death. It's important to seek medical attention immediately if you experience any severe symptoms such as trouble breathing, persistent pain or pressure in the chest, new confusion, inability to wake up or stay awake, or bluish lips or face. Section 5. The importance of vaccination. Vaccination is the most effective way to protect yourself and others from COVID-19. Vaccines work by teaching your immune system to recognize and fight the virus. COVID-19 vaccines reduce your risk of getting sick with COVID-19, prevent severe illness, hospitalization, and death from COVID-19, and help to reduce the spread of the virus. The Centers for Disease Control and Prevention, or CDC, recommends that everyone 6 months and older get vaccinated against COVID-19. Talk to your doctor about which vaccine is right for you. It's important to stay up to date on your COVID-19 vaccinations. Immunity from vaccination and prior infection can wane over time. Booster shots are available to help maintain protection against the virus. Section 6. Evolving variants. The SARS-CoV-2 virus is constantly changing. New variants of the virus emerge over time. Some variants may spread more easily than others. They may also cause different symptoms or be more resistant to treatment or vaccines. Scientists track the emergence and spread of new variants. They use genetic sequencing to identify and characterize different variants. The World Health Organization classifies variants of concern and variants of interest. Variants of concern are more transmissible, cause more severe disease, or are more resistant to vaccines or treatments. Variants of interest have genetic changes that may affect virus characteristics and have caused significant community transmission or multiple COVID-19 cases. Staying informed about the latest variants and following public health recommendations is crucial for protecting yourself and others. Section 7. What to do when infected. If you test positive for COVID-19, it's important to isolate yourself from others, even if you are vaccinated. Stay home and rest. Drink plenty of fluids, monitor your symptoms, and seek medical attention if they worsen. Follow the guidance of your healthcare provider. If you have tested positive for COVID-19 and are at high risk for severe illness, treatments are available that can help prevent hospitalization and death. Talk to your doctor about whether you are eligible for treatment. After you have recovered from COVID-19, you should continue to follow public health recommendations, such as getting vaccinated and boosted, wearing a mask in indoor public settings, and washing your hands frequently. Section 8. Global Impact and Statistics. COVID-19 has had a profound impact on the world. As of October 2024, there have been over 800 million confirmed cases of COVID-19 and over 6.8 million deaths globally. The pandemic has strained healthcare systems, disrupted economies, and caused widespread social and economic hardship. While the situation has improved in some parts of the world, the pandemic is far from over. The virus continues to circulate and evolve, and new variants pose ongoing threats. Global vaccination rates remain low, with significant disparities between high-income and low-income countries. This inequality in vaccine access hinders global efforts to control the pandemic. Section 9. Staying informed and protected. Staying informed and following public health recommendations is crucial for protecting yourself and others from COVID-19. Reliable sources of information include the World Health Organization, the Centers for Disease Control and Prevention, and your local or state health department. You can stay protected by getting vaccinated and boosted, wearing a mask in indoor public settings, washing your hands frequently, avoiding close contact with people who are sick, staying home when you are feeling unwell, and getting tested if you have symptoms. Remember, we are all in this together. By staying informed, taking precautions, and supporting each other, we can navigate this ongoing pandemic and build a healthier future.